Dr. Robert Ross is here now, president of the California Endowment. Thank you for being here.
Thank you, Dina. Good to be with you.
Talk a little bit about how race and racism play into the social determinants of health.
Well, we now know that race and structural racism are the starting points for the social determinants of health. The social determinants of health are profoundly structural and systemic in their orientation. They show up in public education, they show up in economic inclusion and economic systems, they show up in criminal justice and justice reform, and they show up obviously in the health systems. So the social determinants of health have their roots in structural inequality, and the roots of structural inequality are steeped in racial injustice, structural racism, and in particular, anti-Black racism. So you can draw a straight line from structural racism to the social determinants of health.
Expand on the work of the California Endowment when it comes to the social determinants of health.
Yeah, at the California Endowment, we've always been focused on the social determinants of health for quite some time. We focused on our 10-year Building Healthy Communities campaign, a $1.5 billion multi-year campaign, working with leaders in 14 economically distressed communities across the state to do a frontal assault on the social determinants of health. Make sure that we're working with community leaders at the grassroots level that are fighting battles in the justice system, in schools, in economic development and economic inclusion, and with the health system and mental health systems to assure that system changes and policy changes are occurring so that we can have better conditions for vulnerable communities to enjoy health.
Tell us a little bit about the California Endowment Summit. Racism is a public health crisis happening on the eve of APHA's annual meeting.
Well, thanks to COVID-19 pandemic and also with the recent law enforcement shootings of Breonna Taylor and George Floyd, it has been made more clear that racism is a public health issue for this nation. So we'll be sponsoring more than one session, but one session in particular, the role that structural racism plays in public health, that structural racism is a public health hazard, particularly anti-Black racism. We're going to be having a session that will look at, for example, how we can redefine and communities can redefine and reimagine public safety as being more inclusive, more public health and prevention oriented, and get away from the hyper-criminalized, hyper-incarceration framework that has defined public safety in this country. We needed to have more of a public health framework for that definition of public safety and make sure that it's more community oriented and takes racial equity into account.
How is COVID-19 impacting the achievement gap among K through 12 students of color? And what can the public health community do to shore up those gaps?
COVID-19 has proven to be a dastardly foe on public education as well. And not only are the educational achievement gaps being exacerbated by COVID-19, but the health status of these young people and their families as well, particularly in social emotional health and mental health. These kids have less access and their families have less access to the kind of health and public health supports that they need. So COVID-19 has proven to be quite the terrible foe in exposing structural inequality in our public education system.